When ordering labs for an expected Ebola patient, the site manager is to call extension 56351 for pickup.
Hi there, we have a suspected Ebola patient and we want to send you some blood samples.
Specimens are not to be collected until confirmation is received from the lab that it is ready to receive specimens for testing. Medical staff must give the lab 1 hour notice to prepare for testing and should never send suspected Ebola samples through the pneumatic tube system. All suspected Ebola patient blood work is to be picked up and transported by lab personnel.
Yes, we are collecting blood gas samples.
Notify the lab immediately if testing for blood gas, as the lab will only have 30 minutes to run the tests. The first step in preparing blood samples for transport is to wipe down each vial of blood individually with Oxivir wipes.
Wipe the sample with an Oxivir TB wipe.
The medical personnel preparing the sample for transport should never directly touch the blood samples until they have been wiped with Oxivir.
Wipe your gloves with an Oxivir TB wipe.
After wiping each sample with an Oxivir wipe, the nurse is to wipe their gloves with an Oxivir wipe and allow their gloves to dry for 1 minute before continuing. Once the samples have been wiped with an Oxivir wipe and labeled, place them carefully into the specimen bag containing absorbent materials and seal tightly. Then wipe the outside of the bag with an Oxivir wipe. Immediately after sealing and wiping the specimen bag, the nurse is to wipe their gloves with an Oxivir wipe and allow their gloves to dry for 1 minute before continuing. Next, place the first specimen bag into a second specimen bag and seal tightly. Repeat the process of wiping your gloves, but wait for the arrival of the lab technician before wiping the outside of the second specimen bag.
Hi, I'm from the lab. Are the specimens almost ready?
Yes, they're almost ready to go.
Great, I'm just going to need to see the final bag wipe.
Of course.
In the presence of the lab technician, wipe the sealed specimen bag with Oxivir. Then approach the lab technician, who is outside the doffing zone, and place the samples into the cooler without touching the cooler.
All set?
Yes, all set.
All right, let's go.
Once the samples have been received, the lab technician will walk back to the lab for testing, escorted by a security guard.